I mean, George tells the story of his 108-year-old grandmother.
She died 106.
106.
When she was 104, she got pneumonia. She has to be hospitalized. So me and my sister, who's a pediatrician, escaped from the traditional medical rules of the medical board and the hospital. I mean, my brother-in-law, she's married to a cardiologist who has no clue about that. So we're injecting her for 2 years, 100 milligrams of Deca every other week. No bone fracture, no cellulitis, hematocrit 41. And she was able, of course, to do some physical therapy. And she survived for 2 years, yeah. And of course, with a plethora of other supplements, that was something miraculous to her.
And that makes sense, right?
A little bit of mustache,
No.
Great.
That is a great story, but that's, and I think I did put that in my book, is that, and not that I don't even want to make reference to the book. I just want to make it sound like I'm being repetitive, but anabolics, they got such a stigma attached to them.
We're
right?
made for elderly people.
It is absolutely perfect for elderly patients, right? Because that's when you're lacking in muscle. That's when it can be life-saving. I mean, God forbid, pneumonia is bad enough. I mean, typically, right, the typical patient, your grandma's age, would fall, break her hip, be hospitalized and get hospital-acquired pneumonia and die because of that, okay? So why not protect against that kind of fall, that kind of trauma resulting from fall, which if you look at the stats, I want to say it's like the third leading cause of accidents, fall, stuff like that. But that doesn't factor in, because if you don't die from the fall within 3 days, at least in this country, it's not counted as death from the fall. You die a month or 3 months later from hospital-acquired pneumonia, and that doesn't count as an accidental fall. So what I'm saying is the numbers are probably higher. So that's a perfect way. I mean, I'm glad you told that story. That's awesome. It amounts to 50 milligrams a week. That's a hefty dose too for, so you don't use that a higher dose for a 104-year-old. I could tell you a quick story.